All right, we're diving into chapter 10. You have moved away from our 3 chapters worth of bones, which is impressive, right? You didn't know there was so much to know about bones, did you? And now we're getting into muscles. And remember how in the first, in our bones section, we spent a bunch of time learning about the tissue of the bones, and then we learned the actual name of the bones, and then we learned how the bones actually interacted together. That was 3 separate chapters, right? Tissue, names, interactions. They kind of do it a little oppositely in the muscles. We're going to learn a bit about muscles, but more about just anatomy pieces first, and then we'll do names. We'll start on this name piece, which again, that's a separate summative assessment we're doing. And we're putting that, I put a bunch of dates up on the Schoology for you yesterday, so you could see the test schedule coming as far as formative assessments, this lab assessment over the muscles, and then our unit test down on the bottom. I did say in class yesterday the final exam will be just a unit test that is different than what is written in the syllabus. I didn't realize that when I said that, but I think I'm okay with that. I'm not going to change it at this point, because I just think it'd be an awful lot to give you a full final exam. I'd end up having to cut it all out, and you'd only have a certain amount of pieces you're dealing with anyway. Does that make sense? So let's just deal with a Unit 4 test, which is enough. It's 4 chapters. The last section is 4 chapters. It is a 4 versus only 3. Yeah. It's a good question. I'll have to spend some time with that. I haven't gotten he asked it will be more than just 50 points for it. In the syllabus, it says the final is 200, right? But I don't see us making 1 unit test that much more. But we'll see. We'll see. It's a good question. Okay, so let's talk about muscles. Okay? And again, as a physical therapist, this is our bread and butter. All right, this is what we love. You want to get physical therapists excited? Let's spend some time talking about muscles and how they work and the kinesiology behind it. Yeah, it's good stuff. That's good stuff. All right? So, again, you can see the study guide. This is up on Schoology. The PowerPoint's up on Schoology as well. Not a ton of stuff in this unit, this chapter. Because if you looked at the chapter, and I'm sure that you have, it spends, I'm not kidding you, from page 308 to 314 is the pieces that we're actually talking about in this chapter that's on this study guide. Okay, so that's what, 6 pages? And then from pages 315, and again, I'm not joking, I'm not exaggerating, all the way to page 369 are all the different muscles. Okay? And as you read, it says, oh yeah, there's lots more muscles than what we've had. We're only asking you we're only covering like a third of them that are here. And there's a much smaller percentage of that I'm actually going to tell you have to know. So yeah, there's a whole lot more, is what I'm saying to you, I guess. Oh my word, no. I could make up some things. I have to admit, there was one of the answers that always makes me laugh from a test I took in gross anatomy in PT school. There's all these little muscles that are right in the back of your throat and your neck, and they're all named for the things they connect to. There's glossopharyngeal, which is basically the glossus is a tongue, the pharynx, the tube in the back, and there's a muscle that connects these two, so that's named that. So they all sound exactly the same, right? And my instructor, well, that's a whole nother story to tell you about Dr. Banks, he literally made up a muscle name and put on the test as one of the options. And of course, that was one I chose. So he would give me tons of grief about that. Anyway. Oh, sure. Yeah, why not? Why not? Obviously, I didn't know the muscles very well, did I? I was just hoping I could recognize them. Who knows? Who knows? All right, what's the purpose? According to your study guide, the purpose of muscles is very straightforward. We are trying to convert chemical energy, which is ATP, and we're trying to make it into mechanical energy. When we say mechanical, we mean moving, right? Actually, things being able to move, like a machine. Our bodies really are machines. There's a number of people who will make those connections that you are the human machine.
Isn't it like that cord that you showed us last time? It looked like a motor.
Sure. Yeah. No. Absolutely. Yeah. That's the cilia. So some functions that muscles perform. There's 5 of them that are listed here in your textbook. The first one is movement. And when you think of muscles, this is what we think of the most, right? That muscles move you, right? And not just move your body like locomotion, but also move things in your body. How does the food get from your mouth to your stomach, out your anus? It's through smooth muscle. It's through muscular contractions. Lunch is good. Thank you for the reminder. Let's pause from this regularly scheduled program to take lunch. I'm going to go out on a limb. It's Thursday. I'm going to bet it's haystacks. Hey, what do you know? I'm a prophet. Haystacks? Haystacks, haystacks. That's, of course, no offense to my good friend, Mr. Lakota. In case he happens to stumble upon this YouTube video. I gotcha. I should? I don't have the voice. The voice is not good. If I sounded like good old Morgan Freeman or someone like that, then it would be impressive. But Josh, I got you. Donnell, I got you. I don't have the nice British accent. If I could do the British accent, I got you, Eloise. Carissa, you want to just scrub ahead like a minute or two if you are listening to this. This is going to take me a minute. Nathan, I got you. Though you're probably already doing that. Carlos, I got you. Camelia, I got you. You 2 fine gentlemen in the back, I've got you. We good? Anybody else? Okay, back to our regularly scheduled muscular program. So movement, number 1. Number 2, stability. By the way, communication is also a big thing as far as movement goes. Okay, so allowing us to actually speak. If I were a hair and you couldn't also, it was very difficult for you to hear. Does that make sense? Sure, right. You go get your teeth taken, like you get a cavity done or something. Yeah, it's terrible. It's just hilarious, right? Yeah, I hear you. Stability is our next one. And this one you don't necessarily think of as much, but stability is just as important as movement. Because if your muscles are pulling on the bones want to move, right? But in order for me to, say, move my arm around, my scapula and my trunk have to be stable. Does that make sense? Otherwise, the muscle that pulled me this way would actually pull my whole body that way. Right? Because I can actually hold on to these right here, and with the same muscle, the same motion that will pull my arms like this, I can pull my whole body. Does that make sense? So I have to have the stability in order to move. And there's a whole set of muscles that do that. Not just only maintaining posture, but also keeping us from falling over and actually stabilizing joints so that things can move. Sir?
Is that why basically every muscle has a contrasting muscle?
Sure, to help with that. Absolutely. To help control that motion. Absolutely. We'll talk more about that today or even tomorrow, depending how far we get. The third function is that they control the openings and the passageways into our bodies. So think about the areas that are open to the outside in your body. Every single one of them, except for your ears, which I'm not sure why. They have got other issues, though. That they all have muscles that control how much they are opening and closing. Right? To keep things from going in or to keep things from coming out. At times you don't want them to. There are muscles here, yeah. But that's another decent one that doesn't have a ton of muscular control. There's muscles. Are you comfortable? Your nose basically just goes up and then back into your throat. So we control it on the bottom end of that? Certainly. You cannot consciously control every single muscle in your body. No, not at all. Your skeletal muscles are the ones that we can consciously control. Like I can move my one eyebrow up and down. And you can do that. Can anybody else do that? Right? Oh, Marlon, she's got the double eyebrow. Nice. That was well done. I literally in high school, like my senior year of high school, taught myself to do that. To lift that one eyebrow. It was a lot of work. I'm very proud of that fact. I'm very proud. Yep, yep, yep.
He kept doing this.
Yeah.
He was able to like do it after a while.
Yeah, it's impressive. Yeah, right. So anyway, so maybe some squad goals for you to work toward in the future, right? But are you comfortable that things also that passageways that also allows things to move through? Again, I mentioned the muscles in your stomach and your intestines that move all this food through. Fourth thing, we're getting into the areas where people don't think about very often. Heat production. Most of the heat that you produce in your body comes from your muscles contracting. Okay? When you are cold, what do? You shiver. That is literally your body saying, contract muscles so that I can get warm. Okay? It's a defense when your body temperature drops. And they give you as much as 85% of your body heat comes from those muscles. The other 15, by the way, would come from the chemical reactions. The actual metabolism of your body. It produces heat. Last but not least, we have glycemic control. When we say glycemic control, we mean blood sugar. And muscles play a huge role in controlling the amount of blood sugar you have in your bloodstream. Because muscles use a ton of glucose, they actually store and absorb a bunch of glucose. Why? Because muscles need to have fuel ready in a moment. Because you never know when somebody's going to come after you and you have to take off and run, right? So your muscles have to store really quickly that energy so that they can convert it to action in a moment's notice. Does that make sense? So they play a huge role. This is why your textbook talks about this, but this is why older people, as they get older, they lose muscle mass. They're not exercising as much. They have a much higher rate of diabetes because these muscles are not performing the way they normally should. It's very interesting. About 600 muscles in the human body. It makes about half of our body weight, which is interesting. And muscle weighs more than fat. I don't know if you all knew this. Fat's actually reasonably lightweight. It's just very calorically dense. You can get a lot of calories from it. But so that's why a scale is not always the best way to measure how healthy you are. Because if you are super muscular, you can weigh more than somebody who's super fat, but the same size. Do you understand what I'm saying? Or if you get into an exercise program, sometimes you actually gain some weight because you're putting on more muscle, which is heavier than the fat you've lost. Does that make sense? So scale's not always the best way. 3 types of muscles: skeletal, cardiac, smooth. We're going to spend most of our time talking about skeletal muscles in this next couple of chapters. Cardiac muscle, there's a whole system called the cardiac or cardiovascular system. We'll spend a bunch of time on that. And smooth muscle, you'll see interspersed throughout. And again, the smooth muscle is the kind you can't control. The same with cardiac. I can't tell you, stop your heartbeat right now. You can't. You can pause it, because it goes lub-dub, pause, lub-dub, pause, lub-dub, pause. Okay? That's what they call it. The sounds. Okay, let's talk about the connective tissue. Or did somebody have a question that I...
Say start. Start it back. Stop.
Huh?
Oh, good. Oh, please start back up again.
Thank you. Good. It's like, what? All right. Connective tissue. Connective tissue. So are you comfortable that your muscles are like a package from Amazon? You've done this, right? You've ordered like a little USB drive about this big, right? And that USB drive is wrapped in plastic that's put onto a piece of cardboard. That cardboard's wrapped in plastic. That plastic is wrapped in a bag. That bag comes in a box. That box comes in a bigger box. And that's finally what they put on your doorstep, right? And you get a package like this for something like this, okay? That's what the connective tissue of muscle is like, okay? You have one muscle fiber. Those muscle fibers are what actually do the work. That's going to be 2 chapters from now. We'll talk about how those muscle fibers work. But every one of those muscle fibers is wrapped in a little sheath. And this is this diagram on the board is there on page 309. So each muscle fiber is wrapped in something called an endomycin. Endomycium. It's connective tissue, loose connective tissue, and it's wrapped it up. Why is it wrapped? Well, we want to provide support and area for nerves and blood supply to come to each one of those fibers, because each fiber needs to have someone tell it, hey, contract, contract, contract. Okay? And each fiber needs tons of blood so that it can get the ATP and the oxygen and the nutrients it needs to actually be able to perform. So that's what the endomyosin does. It also provides a chemical environment to allow that muscle fiber to contract. And we'll talk all about how that works in the future. The perimyosum is a thicker layer of that connective tissue that wraps these muscle fibers into bundles. And we call those bundles fascicles. So think of, if you've ever looked at a building being constructed or seen like the core of one, you have little pieces of rebar steel, right? Like steel rods. And they wrap a bunch of those steel rods together to make a stronger, thicker steel rod. Or think of a bridge. Have you ever driven over the Bay Bridge, right? It's a suspension bridge. Those cables, right? Have you ever looked at the big cables that hold that thing up? They're all made of these much smaller steel cables that they've wrapped into these big bundles, because those big bundles of steel cable are much stronger than if they had one super thick cable. And muscles work exactly the same way. The perimyosin wraps them into these bundles. The bundles are called fascicles. And those fascicles then are what make up a muscle. Does that make sense? We then take that whole muscle and we surround it with the epimyosin. So, again, endomyosin, the inside, right? Endo means in. Each muscle wrapped in endomyosin. We take a bunch of muscle fibers, put them in a group. We call that a fascicle. That fascicle is wrapped with perimyosin. And then the whole bunch of those fascicles come together. That makes a muscle, and we wrap that muscle in epimyosin. David, your question. Mm-hmm. Sure, it's actually the individual muscle fibers that are tearing when you're doing that. And that's a good thing, because when that happens, your body says, ooh, I need to make more of those. The amount that I had wasn't enough to withstand this force. I need to add more. And that's how you get bigger, absolutely. Yeah, if you tear much more than that, that's where you get like actual problems, where you've torn a muscle that you have to have surgically repaired. Does that make sense? And last but not least, when we have a bunch of muscles that are together, we wrap them in what's called fascia. And it's a connective sheet that's separating neighboring muscles or muscle groups from each other. You meat eater folks, how many of you have eaten a steak? Okay? You know that thick stuff that you just cannot really chew? Not the fat. I'm talking about there's always this gristle kind of stuff that's really thick. It's hard. That's fascia. Because again, every animal has got this fascia. When we work with our pigs or with our cats, you will see that there's fascia everywhere. It's that thick, like, a steak kind of, again, I'm a terrible drawer. It kind of looks like this, right? And here's the bone piece. And there's like little lines that kind of divide it into different sections. And they're thicker, they're different tissue. Because you're eating muscle. You realize that steak is just the muscle of the cow. Yes. Mm-hmm. And what those thicker, harder to chew pieces are, that's the fascia. That's the fascia. Okay? And sorry, those of you who are listening, you couldn't see that beautiful drawing. It's terrible. It's terrible. It looks horrid. Let's just be honest. I appreciate your support. All right. And again, this lovely picture on page 309 shows you how all those pieces wrap together to make one nice, lovely muscle. Okay, let's look at these different fascicles. The fascicles, how they're oriented, they have different names for them. You notice on your study guide, I did not ask you to learn all of these names. I didn't see any real reason to have you do it. Okay? But based upon the orientation of these fascicles, we give them names. Okay? And so this picture here is in your textbook on page 310. Sir? This one here? So that's called a parallel muscle. That would be like your abdominals, like your rectus abdominis. It's literally like a tube of muscle that's together there. Let's talk about those pieces. Okay? So, the strength of a muscle, and this is a piece that I did put in your study guide. I do want to make sure you're comfortable with this. Shh. That the orientation of the fascicles determine the strength and the direction that that muscle is going to pull. So basically, the shape of the muscle determines what it does. Because muscle tissue is very simple. It goes from this to this. It is wider and it shortens. That's all that muscles can do. Okay? They literally have fibers that go like this. Like two combs coming together, right? And when they tighten, when it contracts, they pull those two combs closer together. When it relaxes, it lets them go back apart. That's all a muscle can do. So to get it to do the 1,000 different motions that muscles do, you have to put those fibers in different directions, in different orientations, in different shapes, in order to make them do specific motions. Does that make sense? And you'll see this when we talk about the individual muscles here. So some names, if you care to see them: fusiform and parallel and triangular and pennate muscles, which are feather. A pennate is Latin for feather. There's unipennate and bipennate or multipennate. One, two, many, right? And then the circular. So you can see, again, based upon the shape, what they're going to do. And they even give you names of different muscles that have that specific shape that are there. I bet you recognize biceps brachii. Did you know you have 2 biceps in your body? And not just on both arms. Okay? But you have a biceps femoris. It's one of your hamstrings. So if you put on a test biceps, you need to tell me which one. Because there's a brachii, which means arm, and femoris, which means leg, like femoral, right? Like femur. Bet you recognize pectoralis major, rectus abdominis. That's the nice six-pack muscle. I'd show you mine, but I'm more of a keg than a six-pack. Deltoids, your big muscle over here, right? That's like this classic dad joke, right? That's good. Anyway, sorry. And then orbicularis oculi. Does anybody know where that is? Orbicularis oculi. That's oris. It's around your eye. It's the muscle that allows you to close your eye. Okay, we'll talk all about these. Okay, let's keep going. Fascia also will divide muscles into what we call compartments. Your textbook has this really nice piece on page 312 that talks about compartmental syndrome, where you can get irritation, inflammation, infection even in a certain compartment of your body. Has anybody ever had shin splints before? Yes. So that's irritation of this anterior compartment. Your anterior tibialis that runs right along your shin, just lateral to your shin, or your tibia, of course, that's what that bone is. If that can get inflamed and irritated, that's what shin splints are. Yeah. It can become much worse. You can actually have infection in there and it's a pain, because all that fluid gets trapped in this compartment, this fascial compartment, and you have to like literally go in and drain it if it gets too bad. Usually it's from overuse. That's a big one, like doing too much running or too much activity with it. It can be that maybe your mechanics of how you're walking or how you're running aren't correct, like your feet are going too flat, they're overpronating. There's lots of different ways, to be honest, but those are kind of 2 of the big ones. Here's a lovely picture that's in your textbook on page 311. And this is just showing you those compartments. Can you see? Can you see that this is a compartment and this is a compartment and there's the middle compartment? This is looking through the back of your leg. So these are your gastroc muscles, your soleus muscle. Then you have these other little muscles that are close to the bones, your fibula, tibia, anterior compartment. You see what I mean there? It's divided like a nice little, like one of those plates you get, that has, here's the place where your vegetable goes. Here's a place for your actual big food part. Yeah, you know what I'm talking about? It's good to see. We're thinking the same. I like it. Sounds pretty tasty. Yeah, sounds good. All right. We're actually doing very good here. So let's finish up this last little piece here about attachments. 2 different types of attachments for muscles to bone. Because of course, almost every bone in our body attaches to a muscle. There's a couple of exceptions. Some of them do attach soft tissue only, like your orbicularis oris or orbicularis oculi. Those are much more fleshy attachments. But you have indirect and you have direct. Direct I talked about first in your study guide because that's how it was in your textbook, so I'll mention those first. There's really no separation between the muscle and the bone. It looks like the muscle is literally growing out of the bone. Okay? There are some muscles, like your triceps on the back of your arm, where those attach onto the humerus. It literally looks like the muscle is growing out of the bone. There's really no tendon there at all. Whereas most muscles are indirect attachment, where the muscle fibers stop and you have this connective tissue that then connects the muscle to the bone. And that connective tissue is what we call a tendon. Does that make sense? So your wrist is an easy place to see this. Okay? If you move your wrist back and forth in flexion and extension, right, you should be able to see some nice tendons that are moving right in your wrist there. Right? Yeah, right on this bottom side of your wrist here. Okay? Those tendons come from the muscle bellies, the actual muscle fibers are way up by your elbow. That's what makes, that meaty part of your forearm. Okay? But then it all comes down to tendons that run basically down to your hand or your wrist that do all the motion. Your hand is almost purely tendons. There are muscles that are in your hand. Have you ever shook the hand of somebody who's like a contractor or who works a lot with their hands? And they've got like these big, beefy, strong hands, right? They've worked all these little muscles in their hands a lot. Those of us who don't do that, we don't have those nice, big, thick, strong hands. But because ours are just mostly tendons. Does that make sense? Uh-huh. They are. Yes, sir. Yep. If you grab onto the table or something and you pull, you can see those nice big tendons. Again, I have long sleeve on, I apologize, but yeah, you know what I mean? Those nice, I call them the cool guy tendons, Oh, you must be a good weightlifter. You got those nice tendons that are going there. Right? Oh yeah. I call this vein right here in the bicep is called the cephalic vein. I call it the cool guy vein. Because if you got that cool guy, oh, you're working out. You know what I mean? Again, I'd show you mine, but I got long sleeves on. So. That's good. Yes, sir. Shh. Well, they're using all the muscles in their fingers. But even on the top of your hands, if you move your fingers around, you see those tendons that are running right across the top of your wrist. So yes, they're using their muscles, the tendons, they're using everything. Yeah. Pianists will have usually good, strong hands as well. Because, they're reaching, they're moving, it always has impressed me they can control all that. I have a hard time picking my nose with one finger. So I'm not sure I could. Yeah, go. Oh, good. Yeah, good. All right. Shh. There is some other pieces, aponeurosis, retinaculum. I didn't put those on your study guide. These are just more connective tissue that either helps separate the muscles from the bone or help hold the tendons in place. You have this really thick band of tissue that goes right around your wrist. It's called the retinaculum that basically holds all those tendons in place so they don't just go flying all over the place.
Sorry, this is kind of going back to the direct attachment.
That's right.
So would that be like a tibial tuberosity?
So that's actually a tendon that comes into that. Yeah, basically from above your knee, all those quadricep muscles come together into one tendon that attaches to your patella, and then they call it a ligament, though I always learned it as a tendon, that goes from your patella down to your tibial tuberosity. But no, that is definitely connective tissue. It's not muscle going into that area. Very few of the direct attachments in the body. Most of them are tendinous. Okay. Last but not least for today, this rocked my world. I have to admit yesterday when I was reading this rocked my world. One of the big, huge things in muscles that you learn are the origins and the insertions of a muscle. Okay? Origin is where it starts from, right? Insertion is where it enters into the bone. And the classic way you look at muscles is that the insertion moves toward the origin when a muscle contracts. So let's take your biceps, for example, right? When my biceps contracts, the origin is up here in my glenoid as well as on my coracoid process, and it attaches onto the radial tuberosity of my radius. Okay? When the insertion moves toward the origin, what happens to my arm? It flexes. Okay? But the difficulty is there are some times that the origin can move toward the insertion. For example, if I were to lock my hand here and this table was heavy enough that I couldn't move, if I contract my biceps, what's going to happen to my body? I'm actually going to move this way, right? So my origin is moving toward my insertion, depending on how things are fixed. So what they've said is most of your anatomy books now don't use these terms origin and insertion because it varies so much based upon how the muscle's moving. If you look in any textbook that is older than the last couple of years, you will see origin and insertion there. I have flashcards in my office from when I was doing PT school that list every single muscle that has its origin and insertion, as well as its action, like what the muscle does, and what nerve innervates it, and its blood supply. Those 5 things, I swear I had to learn those over and over and over and over again. A lot. I do still have it in my office, yeah. It was something I bought. I didn't make them because they had lovely pictures and stuff on them. Yeah. So we will learn some of these, and again, I'm going to give you some information about this coming forward, because that's why I had you learn some of these bone pieces, is so that you could see, oh, that's why this little bump is there, because a muscle attaches to that. And if you know, like when I said coracoid process, you know what I'm talking about, right? The piece coming off of the scapula below the acromion, right? And when I said radial tuberosity, oh, right, that's the bump on the radius, right? Forgive me 1 second. Okay? So again, we'll learn a bit of these in your textbook. So if you want to, let's just flip over real quick. Let's look at page 321. How about that? There's like literally any page we could choose here. This is the muscles of the face, muscles of facial expression. Can you see that they have a list, these tables, the whole rest of your chapter, like 70 pages worth of these tables. The tables have the name of the muscle. They have the action of the muscle, what it actually does. Instead of saying origin insertion, they just say skeletal attachments. The top one is what they would normally have called the origin. The bottom one is what they call the insertion. But again, in this textbook, they don't differentiate between them. They just say, here are the places where this muscle attaches to the bone. And then last but not least, they give you the innervation, what nerve actually supplies that muscle. And that's a way that we medical folks would actually test nerves. Like if I want to see if your C7 nerve, okay, remember your cervical spine, 1 through 7? C7 is the nerve that comes out between C6 and C7. If I want to know if that nerve is being affected, I test your triceps. Because that nerve goes to, C7 goes to your triceps, one of the major muscles it innervates. If I want to check your C6, I check your biceps. Does that make sense? So nerves go to different muscles. We'll talk much more about this as we go through. Any questions that you have for me? You realize, of course, we're rolling down to almost halfway through this today. But I don't feel like that was too fast. I feel like we were just kind of moving along nicely. A little bit slower, a little bit calmer. Questions here? All right, let me turn off this lovely recording.